4, 3, 2, 1. We're good to go, Lisa?
Yeah, go ahead. Yeah.
Okay. Call the meeting to order for the Comox Strathcona Regional Hospital District Board for Thursday, March 18th, 2021. And the first item is just to recognize that we're on the traditional territory of the Comox First Nation. And item C, adoption of the minutes of February 25th.
Move adoption.
Okay, thank you. Any questions, discussion? Seeing none. Is there anyone opposed? Adoption is carried. Business arising from the minutes. Seeing none, no petitions and delegations. Item F, reports, the audit findings and financial statements.
Move receipt.
Second.
Thank you.
Second.
Thank you. And we have Corey Vanderhorst, MNP LLP, will present the results. And did you wish to say anything, James or Russ?
All good.
Pardon me?
Nope, all is good.
Okay. So on receipt, now is Corey there to present?
Yes.
Okay.
I believe so. Yeah.
Yeah,
And I will.
Can everybody hear me?
We
Yes.
can. Yeah.
Nodding heads, great. And sorry, staff, can you clarify? You've got your presentation up. Kevin or Mariah, is somebody going to walk through that, and I'll tackle the audit piece.
Through the chair, Corey, Mariah's here, and do you want to go ahead first, and then I'll do the financial statement overview?
Perfect, thank you. Yeah. So I'll be real quick on the audit side of things. All wrapped up. The audit went very smoothly. Thank you to Mariah and Kevin and the regional district staff that helped put together the hospital district information. No items to report to the board here today. We're going to be handing over a clean audit opinion after the review of the financial statements and the approval by the board here. So that's about it for my report. You do have a copy of my audit findings in your package, which really is a sort of a no news is good news type of story. There's not anything to report there. I'm happy to take any questions from the board if there are any.
Any questions, board? I don't see any hands up, so thank you very much, Corey, and we'll turn it over to Mariah, I guess, and your financial overview. Oh, I guess I should call the questions first though, right? On receipt. So no questions on receipt. So anyone opposed? Consider the motion carried. And the recommendations?
Move the recommendation. Second.
Thank you. And Mariah, we'll turn it over to you for the financial overview.
Great, thank you. To the chair, I just have a quick presentation here today. So moving on to the highlights. The core focus of this budget in the past few years and going into the future right now are the payoff of the North Island hospitals in Kamloops River and Courtenay that were completed in 2017. So we did accumulate quite a bit of reserves to fund this hospital build, but we did have a long-term debt of $90 million that was issued in 2018 for 10 years at 3.2%. So that's averaging, or that's cost us $10.7 million until the end of 2028, and then that debt does fall off. The budgeted annual grants to Island Health is allocated at $1.88 million per year. That's 1.85 for sort of those small minor grants to the different facilities, as well as the 30,000 global grants to the smaller clinics. We have had in recent years that $17 million requisition, and that did allow in 2020 a $6.4 million transfer to reserve. So moving to the next slide here. Just a quick overview of the statement of financial position. So our financial assets went up from 19 million to 25.8. And again, that is essentially the reserve with some small receivables. So within that reserve, there is an allocation of commitment to Allen Health for around $2 million. So that leaves us around 23 million for future initiatives or priorities, possibly coming out of strategic planning with the board. The liabilities are from 83 to 75 million. So we're paying approximately 7.8 million on debt principal annually. So you'll see that continue to decrease into the end of 2028. Moving to the next slide. The statement of operations. So we have that $17 million of revenue. So that's that requisition. We have some grants in lieu and some interest revenue we earn on our reserves. Our expenses are, typically around that $3 million mark. Most of that is the debt interest of $2.8 million. The grants to the Allen Health were lower this year compared to budget, just depending on timing of their expenditures. So we do carry some of those over year to year through the budget typically. So our surplus is appearing to be $14.5 million, but that does get allocated then to debt principal payments and transfers to reserve, as you can see there. So just on the last slide here, I'm happy to take any questions that you may have on the financial statements.
Any questions?
I have one, Mr. Chair.
Go ahead, Director Wally.
Yes, is it technically feasible to apply unappropriated surplus to the deficit?
Through the chair to Director Wally, essentially the deficit that's shown there is just our net position because we do have that debt for the hospitals and we have some reserves. So that net sort of 49 million is just our assets over liabilities. So as we continue to pay off the hospital, that deficit will decrease. And previously when the board was committing sort of approximately $5 million for reserve, we were sort of projecting up to increase our assets and then decrease our liabilities. So in 2021, currently the board has decided to kind of hold off on those reserve contributions. So we expect those sort of assets to maintain at that similar level unless they're spent, but that debt will continue to decrease over time until 2028. So we're sort of locked into those long-term debt commitments at this point.
I believe, just to answer what I think was Director Wally's question, we cannot pay off our MFA loan early, can we?
No, sir, we cannot. It's a bond with the Municipal Finance Authority for 10 years, so we cannot.
Okay.
Thank you. That clarifies it.
Okay, any further questions? Seeing none, do we have I've got the motion for the recommendation is on the floor. So anyone opposed? Seeing none, we'll call a motion carried. On item 2, the management report.
Move management report. See.
Second.
Thank you. Any questions on the management report, or did staff want to go over it at all, Russ?
No, but we're here to answer any questions that the directors may have of the management report.
Okay. Any questions on the management report? Seeing none.
Oh, Chair Cornfield.
Yes. Oh, sorry, I couldn't see your hand.
No problem. Not a question, but just a comment. I really appreciated under the action column having the dates and the meetings listed of when items were coming back to this board. So thank you to staff for providing that.
You're welcome. We had a meeting, Director Hillian and myself as chair and vice chair with staff as a follow-up to our strategic, and made a decision to hold off till the April 8th meeting to give staff time to prepare all the reports, because as you see from the management report, there's a fair bit of work there that needs to be done. Okay, and Director Anderson.
Thank you, Mr. Chair. I'm just wondering if it's appropriate for directors from the rural areas to liaise with staff at all to help them connect with the clinics and healthcare providers in our respective communities. Item number 2, that staff prepare information regarding community health service hubs. I was just in conversation with the Community Health Association yesterday here, about some related matters, and it didn't seem like there had been contact yet. So I'm just wondering if I can facilitate that, who to be in touch with. I do have some information about their aspirations that I could pass on.
Okay, I will put that through to our staff, our CAO, Russ.
Yep, thank you very much, Karen, for the suggestion, Director. I'm just going to ask Mariah to provide a response.
Great, thank you. Through the chair to Director Anderson. So we do have a follow-up meeting planned with Island Health next week. So we'll be following up with them to sort of plan for next steps. And I think a key question we'll be working with Scott and Max on sort of them connecting with those clinics and kind of making that contact. So just sort of making sure we're making steps to reach out and talk to those clinics and see what those needs are. So we will pass on that information to them.
So it's them or our staff that are writing those reports and reaching out to the clinics?
We'll be collaborating with Island Health through that process. So I know that's been sort of top of mind for us, working with Island Health and letting them know the interests of the board and for us to really explore the possibilities with rural clinics. So we would expect that they would have been reached out, but if anything, we want to make sure we connect with them next week to do that and sort of decide at that point who is making that contact or reaching out. So.
Okay, so I was on a call yesterday with the clinic and some Island Health folks. So at some point when you know, could you just let me know who to connect with, either in Island Health or the hospital district staff, and to make sure that those connections have been made?
Yep, yes, of course.
Thank you.
Okay, anything further on the management report? We have a
Sorry,
motion.
Director Lee would like to speak.
Okay, I don't have Brenda's, okay.
Oh, I don't
Put your
have
hand
a
up.
hand on my thing.
Okay.
I'm not on the Zoom.
Okay.
Director Anderson's question just twigged a question in my mind about when the vaccines are being delivered to communities. Are they going to be administered at these clinics in the rural areas, or and will Island Health require any extra funds for doing that job if they are?
There's no request being made of the hospital district with respect to the vaccine rollout. I can say from the perspective of the EOC for the Comox Valley that Island Health are sharing their plans and proposals, and there are considerations being given to the island communities in terms of their rollout. I would check with the Strathcona Regional District staff as to what communications have been provided by Island Health to help support the answer to that question.
Okay, all I've heard is that there's one in Campbell River at the community hall, but I don't know about outlying areas and clinics.
Yeah, I think Director Lee, that's an Island Health question,
Okay.
not one that's appropriate for our board. Director Adams and then Director Unger. You're muted, Andy.
Thank you. Thank you, Chair. Just to the previous comment regarding information on the community health and service hubs. I know Mr. Dyson and Ms. Ford have always done a great job, but just to remind that information going to one director should go to all. Thank you.
Thanks for that, bringing up that
Acknowledged.
point.
Thank you.
And my question was the other way around.
Excuse me. Put your hand up if you want. Director Unger is the next speaker.
Thank you, Chair. Just for information to the board, I know Island Health has been in contact with our office in the village of Gold River to discuss the sites and places where people will get their shots.
Right. Does it include the outlying areas, Director Unger?
I'm not positive. I know our First Nations has been done already on the reserve, so I'm thinking it's just the village of Gold River.
Okay, I'm giving you guys lots of latitude to talk to us about something that we haven't been requested to provide.
Correct.
So let's try and, sure there'll be lots of communication on the vaccine rollout with the appropriate jurisdictions. which I would suggest is probably the regional district boards as opposed to the hospital district board. But I have Director Anderson and Abram and Director Davis, you put your hand down.
Yes, I was just going to comment that we're getting our rollout on the 29th and 30th. So,
Yep. Okay. Director Abram.
Yes, thank you, Mr. Chair. With regard to Director Adams' comment, I got an email yesterday from Patricia Smith from Island Health, basically notifying me of the Campbell River situation, changing from the community center to the hospital, to outdoor tents. And secondly, that the outline areas will not be notified of their date until just after April 12th. They are supposed to make their decision on what communities, where and when, and how it will happen. Right now, they're saying they just don't know.
Right.
So that's the email I got. I'm sharing that with all directors.
Yeah.
And that was just to be clear, that was sent also to our Sean Koopman, to our emergency services people, and they were apparently going to spread that around.
Good, thank you. Director Anderson and then Director Davis.
Did you do just to respond to Director Adams, I wasn't asking for any information. I was just asking where to send information to. Thank you.
Okay, thank you for the clarification. I don't see any other hands up. So anything further on the management report? Seeing none, I'll call a question. Is there anyone opposed? Call the motion carried. Recommendation for adoption is bylaw number 295, being the annual budget.
Move
bylaw.
adoption.
Thank you. Discussion? Seeing none, call a question. Is there anyone opposed? Seeing nothing, motion carries. So recommendation number 2, bylaw number 296, being moved. Thank you. Our capital expenditure bylaw.
Second.
Any discussion? Seeing none, call a question. Is there anyone opposed? Motion carries. No new business, no addendum, no media questions.
Move termination. Second.
Thank you very much.
Second.
And our time is, let's see, we started late, 5,